Moving to a new country, it's an exhilarating chapter, isn't it? Just full of fresh starts and amazing possibilities.
Absolutely.
But let's be real, it also throws a whole new set of systems at you. Everything from, banking to getting around.
Right.
And then there's something as absolutely fundamental as healthcare. I mean, how do you even begin to navigate that in a totally new place?
Yeah, that's a perfect way to put it. That initial challenge. For anyone new, figuring out how to access essential services is just, well, paramount. And healthcare. That often feels like the biggest piece of the puzzle. It's about more than just like immediate medical needs. It's really about feeling secure, feeling like you belong in your new home.
Couldn't agree more. And that's exactly why we're doing this deep dive today. We want to demystify the Canadian healthcare system, specifically for you, the newcomer.
Right.
We've pulled all our insights from a really fantastic, comprehensive source. It's called A Newcomer's Guide to Canadian Healthcare.
And our mission here, it's pretty clear. Take all that practical, really actionable info from the guide
Yeah.
and boil it down into clear, understandable insights. We want to give you those sort of aha moments, help it all click so you feel confident, prepared to handle healthcare here in Canada.
Okay, let's dive in. First level, the basic idea of Canadian healthcare. For someone coming from maybe a totally different setup, what's the biggest thing they need to grasp about how it works, like day to day?
Okay, the foundation, the absolute core principle is that Canada has a publicly funded healthcare system.
Right, publicly funded.
Now, publicly funded, that's not just some jargon. It's really the philosophy behind it. It basically means essential medical services are seen as a right, not something tied to how much money you make.
Okay.
The government covers most of these key services through provincial or territorial health insurance plans. And the whole system, it's paid for collectively through taxes, not by private fees when you walk in the door.
So the real aha moment for a lot of people is probably realizing that this collective approach, it's meant to remove that money worry right when you actually need care.
Exactly.
You're typically not pulling out your wallet when you visit a doctor or a hospital for these covered services if you have that crucial piece of plastic, the health card.
And that leads us perfectly to the next step. Your absolute must-do number one when you land, applying for that health card. Think of it like your passport to the whole healthcare system.
Right. Now, here's something that often trips newcomers up, and we really need to flag this clearly. Each province or territory, they issue their own health card.
That's vital.
So you have to apply as soon as you arrive in your specific province or territory. But here's where it gets, well, critical.
Yeah.
Waiting periods.
Yes, this is often a point of significant confusion and honestly risk. While some provinces, thankfully like Ontario and Alberta, at least as of 2020, had no waiting period.
Okay, good to know.
Others definitely do. For instance, British Columbia and Quebec, they both have a 3-month wait before your public health coverage actually starts.
3 months. Wow.
Yeah, and other provinces and territories vary. So job number one is checking the local government website for your province immediately. It's just non-negotiable.
That 3-month gap especially sounds like a really critical window. What's the absolute must-do for someone facing that wait to protect themselves, medically and financially?
Well, the guide's advice on this is crystal clear. If your province has a waiting period, you should absolutely look into getting private health insurance to cover that gap.
Right, just temporary coverage.
Exactly. You just don't want to be caught without any coverage in those first few months.
Yeah.
It's a proactive step, and it can save you a ton of stress and, frankly, money if something unexpected comes up.
Okay, so you've navigated any waiting period, you've got your health card in hand. The next big question is, what does this card actually cover? And maybe more importantly, what might surprise you by not being included?
Generally, yeah, the publicly funded system covers those essential services. So visits to your doctor, stays in the hospital, diagnostic tests like x-rays or blood work. That's the core safety net.
Okay, the basics.
The basics.
But a common mistake is thinking everything medical is covered. The guide really emphasizes that things like most prescription drugs you get from a pharmacy.
Right, outside of a hospital.
Yeah, outside the hospital. And dental care, eye exams or glasses, ambulance rides, physiotherapy, those often aren't fully covered by the public plan.
Exactly. And that distinction often comes down to how the system developed historically. It initially focused hard on those urgent doctor and hospital kinds of needs.
That makes sense.
So for these other things, dental, vision, physio, drugs, you'll typically need private insurance. either
Yeah.
through your job, if they offer benefits,
Smaller benefits, yeah.
or by buying a private plane yourself. It's definitely something to factor into your budget when you're planning your move.
Okay, so you've got the card, you understand the coverage basics. Next big mission, finding your primary care provider, like establishing your healthcare home base.
That's your family doctor,
Mm-hmm.
or sometimes called a GP, general practitioner. This person becomes your main point of contact for healthcare.
Okay.
They coordinate your care, give you referrals if you need to see a specialist, manage your long-term health stuff. The guide actually gives some practical tips on where to look. Like in Ontario, they have a specific service called Healthcare Connect to help match you with a doctor.
Oh, that's handy.
It is. But finding one can sometimes take time. So while you're searching, walk-in clinics are a really good temporary fix for non-urgent issues.
Right, so you're not just left hanging while you search.
Exactly. And don't overlook community support. Those local settlement agencies we mentioned. They often have people, like health navigators, who can physically help you.
Help with what specifically?
Oh, with filling out the health card forms, finding doctors, accepting new patients nearby, maybe even explaining hospital stuff in your own language. They're like your personal guide to the system.
That sounds incredibly valuable.
It really can be. Oh, and a key point.
Yeah.
You usually don't need a referral for a walk-in clinic.
Yeah.
Just show up. But for specialists, you almost always need that referral from your family doctor first.
Okay, so it's really about matching how serious your issue is with the right place to go. That seems critical for newcomers. Like, imagine you just arrived, you're super jet lagged, and you get a really nasty cold. Your first thought might be emergency room, but you're saying probably not.
Right, precisely. That's a crucial difference to understand. Walk-in clinics?
Yeah.
They're for the non-urgent stuff, that bad cold, a minor cut needing stitches, a rash, things like that.
Huh.
No appointment needed.
Right.
The emergency room, the ER, that is strictly for serious or life-threatening conditions, heart attack symptoms, serious accidents, trouble breathing. And if you do go to the ER for something less critical, honestly, be prepared for potentially long waits, because the really critical cases will always get seen first.
Makes sense. And the most vital piece of info from the guide about real emergencies.
Call 911. That's the number across Canada for police, fire, and ambulance. If it's a life-threatening situation for you or someone else, don't hesitate. Just call 911.
Okay, 911 for emergencies. Got it. Now let's shift to prescription meds, another area with lots of questions, especially about cost.
Yeah, as we sort of touched on, prescriptions you get filled at a pharmacy are generally not free in Canada. Not unless you have specific insurance that covers drug costs.
So what should you do if you're arriving with prescriptions you already take back home?
The guide strongly advises bringing those prescriptions with you. Get them translated into English or French if you can.
Good tip.
And then, once you find a family doctor here, show them your prescriptions. They can usually help transfer them or write you new Canadian ones. And it's also worth knowing, this is important, some provinces have special drug benefit programs, maybe for kids or seniors or people with lower incomes.
So how do you find out about those?
Ask. When you register with your family doctor, just proactively ask them, are there any provincial drug programs I might qualify for? It's a question many newcomers don't even know they can ask, and it could save you quite a bit of money.
That's a great piece of actionable advice. Okay, let's talk about mental health services. Super important for overall well-being, but maybe gets overlooked in that initial scramble to settle.
It really does. And the guide points out that, similar to dental or vision, mental health care often isn't fully covered by the public plans either. Therapy sessions, for example.
So if it's not always covered publicly, where can people find support, especially if finances are tight early on?
Yeah, that's a key question. The guide highlights several options for free or lower-cost support. Community health centers often have services. There are crisis lines like the national 9888 number now, available 24/7 for mental health crises.
988.
And various nonprofit organizations like the Canadian Mental Health Association, CMHA, they have branches across the country offering support programs. These resources are really designed to be accessible regardless of your insurance situation.
That's really good to know there are options. Now, another common worry, totally understandable, language barriers. Trying to explain symptoms when you're not feeling well is hard enough in your own language.
Absolutely. But here's some genuinely positive news from the guide on this. Many healthcare providers, hospitals, clinics, they actually offer interpretation services.
Oh, really?
Yeah. Or they might have staff members who speak various languages. It's becoming much more common, especially in larger cities.
So what's the practical tip here?
Ask. When you book an appointment, Or even when you arrive, just ask if they have language support available for your language. Don't be shy about it. Your understanding and their understanding of you, it's absolutely vital for good care.
Definitely. Okay, as we start to kind of wrap up this deep dive, the guide pulls together some really essential, practical tips for making your healthcare journey in Canada smoother. It sounds like being proactive is key.
Totally. It really emphasizes a few things. First, try to register with a family doctor as early as you can. Don't put it off.
Right.
Second, learn the local emergency numbers and services for your specific area. Know where the nearest hospital or ER is.
Good point.
And maybe most importantly, keep a really clear, organized record of your vaccinations and your medical history. Bring copies from your home country. This is invaluable for your new doctors here.
Saves so much time and potential confusion later.
Exactly. Oh, and a modern tip the guide mentions is using online patient portals, things like MyChart or Health Gateway, depending on the province.
What do those do?
They let you securely log in online to see your test results, maybe appointment notes, other health info.
Yay.
Gives you more direct access and control over your own records, which is great.
Very convenient. Finally, the guide shares some key resources, places newcomers can turn to for help, not just with healthcare, but settling in overall.
Yeah, these are sort of the go-to places. You've got the official government source, Immigration, Refugees, and Citizenship Canada, that's IREC, for all the official policies programs.
Okay.
Then there's settlement.org, a fantastic online hub, especially for Ontario, but useful broadly, with info on everything, housing, jobs, schools.
Sounds like a one-stop shop.
Kind of. And then crucially, those local newcomer agencies. Organizations like the YMCA, Mosaic on the West Coast, Coast TI in Ontario, many others, depending on where you are, these are your people on the ground.
The ones who can offer that direct personal help.
Exactly. Connecting you with services, community groups, and often, yes, direct help navigating the healthcare system specifically.
Wow. Okay, so pulling it all together, this deep dive based on the guide has really given us, I think, a much clearer map of the Canadian healthcare system from getting that first health card.
Right, and navigating those waiting periods.
To understanding what's covered, finding a doctor, knowing where to go for urgent versus emergency care.
Dealing with prescriptions,
Yeah.
accessing mental health support, even overcoming language barriers. All those
Totally.
practical steps.
And that's exactly the clarity we hope to bring you. Because having this knowledge, it really empowers you, doesn't it? To make informed choices about your health, your family's health, right from the start. It's about more than just, knowing the rules. It's about feeling truly prepared, feeling secure as you build your new life here in Canada.
Absolutely. So maybe, as a final thought for you to consider,
Hmm.
as you continue to settle in and build your new life here, how will understanding this vital system, this healthcare piece, how will that shape your overall sense of security and belonging? How does knowing this foundation is there let you focus on all the other exciting possibilities ahead?